We'll give everybody a couple of minutes.
Oh yeah, we were in the other we were in the other session there, chit-chatting about advocacy and all the affiliates, telling them thank you and we appreciate them, and just talking about advocacy. So
I reached out to one of my persons in Madison, Indiana.
uh-huh.
So she's the closest one to me. Well, of course I'm in Louisville, but with me working over there, so I'm excited about working with her on some stuff.
Oh,
Well,
good.
mm-hmm.
Yeah,
Well,
I give everybody a minute or so because they might be coming in from the little presentation we just had.
okay.
Yeah, let me see, what time is it? I know it's 1:36. Okay, we'll just give them one more minute, then we'll get started.
Okay.
People probably will start joining in because they're still trying to figure out this room A, room B. I figured it out pretty good.
Mm-hmm. I'm excited.
Yeah.
It goes to show how much when you are forced to do stuff,
Hmm.
how much you have to do.
Yes. Okay, well, we have one lady on there and she just disappeared. And this is like yep, like 4B, I think is your session. Yeah.
Mm-hmm.
Well, I don't want to start without, or should we start? I mean, I know that people registered for your presentation. This is kind of strange.
Mm-hmm.
There's Melanie Frazier. Okay. Well, we'll go ahead and get started and hopefully people will start to come on. So I'm Melanie Cunningham, Executive Director for NAMI, Kentucky. And this is our session 4B with Robin Harrington, Clinical Social Worker. And she is the Assistant Professor at Ivy Tech Community College in Sellersburg, Indiana, right?
Mm-hmm.
Yeah. And she is Assistant Professor and Program Chair. So we want to introduce her, and she's going to talk to us today about something very dear to her heart. And she and I had a little talk too about this when she did chose this topic when people get newly diagnosed with a huge mental or physical health, which can also affect your mental health diagnosis. So, without further ado, we will welcome Robin Harrington.
Thank you so much, Melanie, for that introduction and welcome, um, Melanie Frazier and BHM GSR. Thank you
Yeah.
for coming to this. So we will be discussing, looking at how an integrative behavioral health approach for persons newly diagnosed with heart disease and autoimmune disorders. Um, we will. Oh goodness, here we go. Okay, there we go. So again, this is just some of my background information. If you needed to get in contact with me for whatever reason, it's on this screen here. I am also a clinical social worker, mental health therapist with Total Restoration Group in Louisville, Kentucky. And so, our learning objectives for today, we are going to hopefully increase our knowledge about chronic illnesses. For this presentation, we're going to look at autoimmune disorders and heart disease. We're going to learn how chronic diseases impact mental health and social functioning. And we're also going to have a better understanding of the role of integrative behavioral health as a treatment approach for persons with chronic illnesses. And then last, we're going to explore the importance of developing positive coping skills and social support networks. So, one of the things that I want to just be fully transparent about is that not only am I talking about this topic from from a psychosocial education standpoint, I'm also coming to you as a person who is impacted by this topic in three capacities. So I wanted to just also provide that other framework for you all as we're going through this presentation. So the three lenses that I'm looking at this is: one, I am a cardiac patient. I have heart disease. Two, my husband he's a type 1 diabetic, and he was diagnosed in his late 30s. And then my son, who will be 16 Monday, was diagnosed 3 years ago with an autoimmune disorder. And his particular one impacts his eyes. So this subject is very near and dear. So some of the information is not really research; it's just is lived experiences, and some is information that I've gathered from working with clients over the past few years who also are who have chronic illnesses. So when we talk about chronic illnesses, there's so many. And one of the things that we know with persons, with who have chronic illness lasts more than a year. It requires long-term medical care, and persons we can experience difficulties with some of our ADLs, our activities of daily living. Some of the chronic illness, some of the chronic illnesses that we're going to not go over, but that's common for many people is we have ALS, arthritis, cancer, Crohn's disease. And even when we look at Crohn's disease, there's so many underneath Crohn's disease that impact people differently. Then we have diabetes, we have obesity, osteoporosis, we have our Alzheimer's disease and dementia, COPD, and cystic fibrosis, of course, heart disease, oral health, and reflex sympathetic dystrophy. Dystroph. I can't pronounce that word. I'm sorry. I just took a medical terminology class, and this was one of my words. I could pronounce it a while ago, but that particular syndrome. And so, one of the things in doing this research is there are so many different ways. There's commonalities in how we all approach our chronic illnesses, but the byproducts, all the different things that we experience is different too. So what may work for me with my type of heart disease, and heart disease there's a lot, is totally different from someone else that I know who has heart disease. Just our medications and different things like that. So that's one of the things that I want people to take away from this, is that just because we may all have different chronic illnesses, it impacts us in totally different ways. And so we cannot just apply a one size fits all when we're working with our loved ones, or if we're working with clients. We have to approach everything from a unique individual standpoint and develop treatment plans in that capacity. When we're looking at chronic illness in the forms of immune system disorders, this is a very broad area, and this is not all the different immune system disorders. This is just a snippet. But when we look at immune system disorders, these disorder they cause abnormal low or overactivity of the immune system. In my son's case, with him having he has juvenile rheumatoid arthritis. With his particular condition, the inflammation impacts his eyes, which causes him to have uveitis, which caused a whole other set of issues going on top of the primary diagnosis. So when we're looking at autoimmune disorders, we're looking at a situation where it's the immune system overactivity. It damages its own tissues. We also have medications that people may take to treat their autoimmune disorder. It also lowers your immune system. So it can be very complicated when we're working with someone who has a chronic illness that falls within the immune system disorders. You may also have people that may not only have one, they may have two immune systems happening. And that can also be, very, just troubling mentally, knowing that you have two autoimmune disorders occurring, but may also have different, um, side effects from medication or just different things like that. So some of the ones that I have listed here is rheumatoid arthritis. We also can see this with JRA, juvenile rheumatoid arthritis. We have inflammatory bowel disease, type 1 diabetes, Graves' disease, Hashimoto's thyroiditis. This particular one, a student of mine, she has the Hashimoto. And when COVID hit, she was sick over the last 2.5 years of her of our academic program. And she's young at the time. I think she was like 20. And so that was my first really like up close of seeing another type of autoimmune disorder. I wasn't even familiar with this. Um, and then we also have lupus, multiple sclerosis, psoriasis, as some other types of immune system disorders. But again, this is not the entire list. There's many more. And like I said, each of these can, you can have multiple. And so that's important, when people may say they have a chronic illness, especially from the immune system disorders, is identifying, exactly what is it, and what does that mean for their health, and what else, do they have? Like I said, again, my husband, he was diagnosed with type 1 diabetes at 37, and that was life changing. And we'll get into that in a little that in another portion of this presentation. But he also has eczema, and eczema also, as a skin condition, with inflammation, as well is associated with um, immune system disorders as well. So you can have, like I said, you can have these multiple um, illnesses happening at the same time, and it can be, extremely stressful. So when we get into heart disease, so now we have heart disease. Now, heart disease consists of many types of heart conditions. The most common is the coronary artery disease, and this affects the blood flow to the heart. When we're getting into this, we're looking at heart arrhythmias, heart failure, heart valve disease, pericardial disease, cardiomyopathy, and congenital heart disease. And some of these, with heart, it can be brought on by several things. Some can be genetic. In my case, mine is genetic. There's some things can be brought on from chronic drug use. If someone has been engaging in, heroin use, cocaine use, anything like that that's putting unnecessary stress on the heart, alcohol. We also have smoking. So you have those type of things, stress. Just from doing research with this particular topic for the past week, I wonder how much of my this heart disease that came about has been associated with stress, because I can pinpoint several stressors within the last 4 years of me having this diagnosis that put a lot of stress on me. So I'm curious, and even going back thinking about the different symptoms I was having. And so the one thing with heart disease is that you have these things occurring. In some cases, you may not know you're having a heart disease episode. Heart disease presents differently in men and women, especially in women. There are things that present that for me, I kept having headaches, I kept feeling nauseous, and I kept having anxiety. Well, come to find out, those were symptoms that I had been having for a while. But then it comes back to the other. I'm looking at it, was it stress or was it that? And so But we can see that heart disease is the leading cause of death for men, women, and people of most racial and ethnic backgrounds in the United States. We have that about close to 700,000 people in the United States died from heart disease in 2020, and that's one in every 5 deaths. So heart disease is something that's very prevalent within the United States, as well as it can be caused from internal and external factors. So how does all this get into our overall topic of today is the mental health. So when we're looking at newly diagnosed people newly diagnosed with either autoimmune disorder or heart disease, the one thing that we know that these are life-changing situations. And so we already know we have this physical change occurring. And it is definitely, it's going to take its toll on you because you're trying to figure out, like in my case, what happened? What did I miss? How did this happen? And so one of the things that I noticed going through this was we get a lot of information at the doctor's office. And you're sitting here with words you can't pronounce, looking at diagrams you can barely understand, and you're trying to understand this new thing, this new illness that you have. But then you're also trying to reconcile the fact that you don't know how to think about it, how you feel about it, or how to handle, this the stress associated with everything. I found going to the doctor being extremely stressful at times. I found it very stressful. And a lot of times I had to go to the doctor by myself. One of the things that came out of my heart diagnosis was, when we're talking about, the mental health side of it, was I learned that I have claustrophobia. And I never in my life, I'm the type, I love going to parties. I'm not stressed if I'm around a whole bunch of people. How did that come about? Me finding out that I suffer from claustrophobia. It was when I had to go get my cardiac MRI. And it was because they were trying to figure out exactly what do you have. So for about 6 months, I didn't really know what type of heart condition I had. So when we're talking about the impact on mental health, here's what I knew. I had shortness of breath. Grocery shopping was a task. Grocery shopping, I had to do everything differently. Plus, we're dealing with this with COVID. So this happened, you all, at the end of 2019, going into 2020. And so COVID's happening. So we got this whole COVID thing going. I don't know what's wrong with my health. It was it was a mess. So that was just a whole other level of stress. So I go through 2020, just not really understanding the changes with my health and trying to figure out how not to get COVID because I have this underlying health condition. Fast forward, 2021 comes and my cardiologist says, we need to go ahead and get this cardiac MRI. I go to get the cardiac MRI, and I can joke about it now, but it wasn't a joking matter last year. But I go, and I freaked out. I get in here, I get into this because I've never been in a cardiac MRI machine in my life. So I get in here, and so some people with heart conditions, we have trouble breathing. So I'm laying down, and it just was a mess. I freaked out. And the people at the hospital, they were very understanding. And that again gets into the next part of this when we talk about integrative health. They understood the anxiety. They understood that the stressor of not really knowing what's going on and how that impacted my anxiety. So now they scheduled me for another appointment like 3 weeks later. I go again, still can't do it. I have another freak out, I have a complete meltdown at this point. And I'm a mental health therapist. I'm like, gosh, what is wrong with this? Is mind over matter? So at that point, I go the same day I go see my cardiologist, and he says, okay, we're going to have to do something different. We're going to continue to monitor your symptoms, but we have to get your mental health situation under control. And so I wanted to just kind of provide context to kind of bring this slide to life. This slide is a lot of data on here, but I wanted to just bring that personal story to highlight this because I have this physical illness going on, but I also have this whole invisible illness happening. And it's scary when you're a professor, you're a mom, you're all these things, and now you're in this vulnerable situation. And so when we talk about, the anxiety, claustrophobia, never knew that was a thing for me. The depression, there was aspects of moderate depression that I experienced, and just other people I know. And just doing this research, there's this depression that you have because you're sad, you're anxious, you feel hopeless. You're trying to figure out what's my quality of life at this point. And these are all things running through your head. And what you have now is you have your depression feeding your anxiety feeding your depression, and you have a heart condition. And all that now equals stress. So now you have all this unnecessary stress. And mine was trying to get a freaking MRI done so I can know what was wrong with my heart condition. And so what I appreciate about this situation was my cardiologist and the people at the clinic that I go to, they took a step back and said, we need to keep her stress level down because now we're seeing her blood pressure is going up. Now we're seeing these things happening, all because I freaked out from this cardiac MRI. And so that's why, understanding not just from the heart piece, but even from persons with autoimmune disorders. Even with autoimmune disorders, my son had to go through, had to take low dosage chemotherapy once a month, and the stress going through that for a child. They're poking on you, they're trying to find your vein. All these different things that one has to go through. You're taking medicines that to help reduce inflammation, is also lowering your autoimmune disorder. So it's all these different things occurring. And so one of the things you all, I mentioned, we talk about mood disorders, depression, and anxiety. Now we're having to adjust to our new normal. How do you adjust to this new normal? And so when we look at from the mental health side of the house, a clinical diagnosis, there is a clinical diagnosis of adjustment disorder. And what the DSM-5 states is that adjustment disorder, dealing with some new type of change or challenge, we're looking at it about 6 months. That's how long you can use that diagnosis for someone, adjustment disorder. In one diagnosis, you have adjustment disorder mixed with anxiety and depression. And I often, thought about that, just going through my own situation and my family's, is that, yes, there's an adjustment, but it's not, but you can't, you really can't put a timestamp on it because things change, your health changes, medication changes. And so, but in terms of from a clinical standpoint, when working with clients, that is something that I've even used with some of my clients who have been newly diagnosed with a particular chronic illness, is that once I find out that they have it, then I start kind of that time frame and say, okay, now look, let's see how everything is going to happen these next few months, and let's put some things in place because there's going to be stressors and different things like that. So that is what we're looking at with chronic illness, the impact on mental health. Then when we look at chronic illness, the impact on social functioning, this particular area, we're looking in now to, okay, now we've been diagnosed with this. Even before the diagnosis, we may have already had some changes in how we had to do things. And so what does that look like? That could be a variety of things depending on your particular illness. And it could be some similarities, between, whether it's autoimmune or heart disease. So for heart disease, for example, depending on if you've had to had some type of surgery, if you've had to have some type of implant put in, or something major, your recovery time and your capability could be totally different from someone who may been diagnosed with something as a little minor than someone having a heart valves replaced. And so, how does this impact the social functioning? Well, as I explained, grocery shopping. So I live in Louisville, and just the thought of having to go to Walmart during this time, it again, it was a stressor to have to go into Walmart knowing I'm going to be out of breath, knowing that I could only walk so far before I have to stop. And I remember my son one time said, "Well, Mom, why don't you get one of those buggies?" My pride would not let me. I'm 40. At the time, I was 42. My pride would not let me get into one of those little scooters in the store. I just couldn't do it. Just the thought of it. Because in my mind, I was still grappling with the fact that I'm 42. I shouldn't be in this situation where I can barely walk around Walmart. Um, and so I had to really adjust temporarily how I did things, going to the grocery store. Again, I didn't put this in the slide, but it probably would have been interesting looking at the intersectionality of how COVID, dealing with this during COVID, because that really impacted not just my movement, but even my student that I mentioned who had the Hashimoto syndrome, and just other people I know who had different things. It impacted the layer of COVID really impacted movement. So one of the things from social functioning that we would experience is, again, physical limitations just doing the fun things you may like to do. Some physical changes from an illness can impact your appearance. It can be in the form of weight gain or weight loss, hair loss, loss of teeth. And these things can really take you from having a very positive self-image into a poor one, which then can cause a person to refrain from social outings or gatherings. And so one of the things with my particular heart condition and other people that I've spoken to, I retain fluid. And so with that fluid retention, through edema, that causes swelling in your arms, swelling in your legs, swelling in your stomach. And so that can be very stressful and can make oneself very self-conscious on wearing certain things, sandals, shirts, just all type of things. Besides the edema, you may have medications that you're taking that can cause you to lose hair. I know I had started a new medication. My hair started coming out. I was like, oh no. I had another friend of mine who was also has an autoimmune disorder that started some medication. Their face kept breaking out. And so these things can, so again, you add on the stress, you're already trying to adapt to this change. Now you having medications you're taking, or just the progression of the illness that's causing a physical change. Those things will definitely impact how one wants to engage in their environments. Then when we look at your work and being able to work, so you may have a situation where you may be fortunate, and depending on whatever your health condition is, you have an employer that's able to work with you and making appropriate accommodations. You may have a situation where you may not be able to work full time, and now you have to go to part time. That part time status now is going to impact that person's financial stability. Then we have a situation where we seen with long COVID that we're seeing now, active things that we're seeing where people had to change. They had to totally leave their work, their career, because they're unable to do that. And so regardless if it's long COVID or maybe you've been diagnosed, with Graves' disease, or you have a congestive heart failure, where your heart capacity may be very low, so you really have to be careful what you do. um that is really detrimental to a person who is used to working 40 hours a week, who maybe they're on this track of promotion and different things. So it is very gosh, damaging to one's confidence, to everything. And we know in the work environment, that's another social environment. And so even with people even working from home, and most of us may have been, working from home, even with COVID, that has even research is coming out showing how that has even impacted how some of us may feel more isolation or different things. And so when we're adding all these things in to this person who has this chronic illness, we can see how there can be a negative impact on the social functioning, which now again takes us back to the previous slide on how it impacts our mental health. Another thing I want to bring up is change in eating habits. And this is a huge thing for folks who are really trying to change the way they're eating and trying to, eat to live, trying to use, food as a medicine. And so this can be difficult if you're in a family or among groups of friends or whatever that thinks broccoli is a four-letter word, where butter is king. And so if you're someone with a heart condition, you want to make sure your cholesterol is very low. So you may have people who are trying to make certain changes, may opt to go to a vegan lifestyle. They may go, maybe not vegan, maybe they're more pescatarian, plant-based. And these changes may not be welcomed or as open in their family. So you may have a situation where this person is saying, okay, I'm newly diagnosed with this particular autoimmune disorder. I want to make sure my inflammation stays low. So I want to have a anti-inflammation diet. And that's perfect. That's fine. But the family, the environment may not support that. So then that creates another issue on social functioning. Uh, my friends laugh at me every time we get together to go out because I'm like, I can't eat this and I can't eat that. And, I have certain places that I can eat at that I know it's not going to mess with my blood pressure. Or, of course, limiting certain things because of cholesterol. And so my friends crack up. They're like, gosh, well, what, oh, you're eating something. I'm like, yeah, I'm not saying I don't, but I'm particular at this point. I have to be, really particular on where I'm going. And I have to ask those questions. What are you cooking? What's in here? Because what I know is there's hidden sodium in so many things. I love Apple Jacks, but the hidden sodium in Apple Jacks is just not worth the visit to the hospital. So I'll just eat an apple instead and pretend and think about what that Apple Jacks tastes like. But it's little things like that that you don't think about, but can impact the social functioning. This other part I want to get into is the chronic illness, grief, and loss. And this is the part that I don't think people really spend enough time talking about and really processing what this grief and loss looks like. And in preparing for this, I did some, very, let me say, just some rude and crude, research. I had contacted just a few of my colleagues that I knew who had either recently diagnosed with heart conditions or autoimmune disorder. So it wasn't a perfect qualitative research, but just asking questions. And one of the questions I asked was, how did you feel when you found out that you had this new diagnosis? How did you feel? And the common response was, I was sad. I was angry. I don't understand. And it was really good just having those conversations. It wasn't necessarily anything therapeutic I went into these conversations for. I was just curious because I knew my response. And so when we look at grief, grief is a deep, intense sadness as a response to loss. And then loss is the absence of a relationship, possession, or a future possession. So when we look at having a chronic illness, that was, I remember vividly in my situation, it was 2019. I was running around campus, just zipping up, just running all around. And I kept noticing, and I have allergies. Who don't have allergies living in Kentucky? Uh, I'm allergic to Kentucky. I'm allergic, literally allergic to bluegrass. So that's always my running joke around the summertime with different things. But it wasn't my normal congestion. It wasn't my normal. It was different. And I remember I got out the car that morning, and I attempted to zip into my office, and it wasn't a zip. I don't know what it was. It was a I got out the car and I tried to walk fast, and I was like, oh my gosh, I can't breathe. What's going on? And I get in there and I get to the elevator and I'm out of breath. And my colleague was like, what's wrong? I was like, I don't know. And so I didn't think no more about it. I get home later that day, I take my allergy medicine, all these things. And over the next 2 days, nothing changed. I kept getting worse and worse. And so I go to the doctor, and that's when they were like, we got to start running more tests. And I remember, like I said, this was summer 2019. And I remember thinking, gosh, everything's changing, and I felt that sadness start to grow, and it grew and it grew and it grew and it grew. And it's hard to explain. Um, it's really nothing no one can really say to you. Um, and so when we're talking about, like, what does that look like? Well, some it could be the loss of functioning through disability. I wasn't that far yet to where I felt like I had a disability, but some people's chronic illness, it could be something that really has disabled you from doing something more long term. The sense of identity, the sense of security, or the loss of a job or financial stability, and then again, just that you have that loss of health. And so, in having uh, these conversations with people, that was the common theme that was coming back from them. Was my one friend, she does martial arts, and we were in my office one day. She's like, I'm 43, I think she's 47. And she cried. And I said, what are you crying about? She said, I can't. She said, I can no longer do my martial arts. She's like, that's what I do. And so it's that loss of identity. Everybody knows her on campus. She's petite, is very petite, but she will beat you up. She trains in Taekwondo, all those things. So for her, it was not being able to engage in that. But we had a conversation about, well, what does Tai Chi look like? She's like, I guess I can do Tai Chi. But it was those things. At the time, I do a lot of community outreach. I'm very involved in the community. So having to slow down, that bothered me. But one of the things that we have to look at is these 5 stages of grief. And that was one of the things that I had to finally come to terms with, was that I am grieving the loss of the change of my health. I mentioned earlier with my husband was diagnosed with his type 1 diabetes in his late 30s. And I witnessed firsthand what that grief looked like. And as a family, there's the vicarious grief and loss that the family experiences. Because if you have one family member who is outgoing, does everything, all type of stuff, and they have that change in health, it just doesn't impact them. It impacts the whole family. And so that was something as a family, my son, my husband, we all had to sit down and we had to sit down and process that. We didn't, at the time, we didn't really know how it was going to be such a huge impact, but it was. And so we had to figure out what's the new normal. So as a family, you will grieve that for that person who lost that. And it can be rough, and there's no time limit on it. So when we look at those 5 stages of grief, we're looking at that denial. I kept thinking for my situation, it's allergies. It's that dang on Kentucky bluegrass. That's what it is. But it wasn't. It was, I have a form of hypocardiomyopathy. That's what I got. Anger. Oh, I was angry. I called my mom because I had to do a background. I had to get all this health information. So now I'm mad at my mom for marrying my dad and having me because I have this. So I have this heart condition. So I didn't took it back 40 plus years. Why didn't y'all check this out? Okay, that was misplaced anger. Then bargaining. Well, okay. Maybe if and this is still part of the denial, maybe if I just really, really get my weight down, and maybe if I do this, and this, it's going to go away. And my doctor's like, no, you still need to do all those things, but it's still, there. And then the depression and acceptance. I had a video that I wanted to watch, but we're not, but I'm just going to put this up here is because the video is 12 minutes long, but for time's sake, I'm not going to get into it, but if you want to take a screenshot of this video by Venus Williams is what started my research. It's a good 12-minute video, and it explains so much of pretty much what we're talking about in this slide. But it's just a really good reference point looking at someone like Venus Williams. She has a Sjogren's syndrome, and this is one of the reasons why she stepped back from being at the height of her tennis career, because she suffers from shortness of breath at times. I think dry eyes. I haven't did that much research, but what she experiences from her particular chronic illness, in her video, she talks about how much it has impacted her way of life. So it's a good video to watch. So then when we get to the point of the integrative behavioral health approach, and just in a nutshell, you all, this is just, just another fancy way of talking about holistic health. And so one of the things that in when we're looking at people who are newly diagnosed with chronic illnesses, it is imperative that hopefully that their particular primary care physician operates in an integrative behavioral approach. And if not, that I think for, again, as a social worker, if you work as a case manager, or if you're just someone, maybe you're a caregiver, it's important that we advocate, that we make sure that our family members or ourselves, we are part of a continuum of care, this where everyone knows what's going on. And part of that is because one of the things here's what I noticed, and you all can read the slides. I kind of like to storytell. I'm a storyteller. One of the things that I want to emphasize is this. When I work with clients and I find out that my clients are coming to me with depression, anxiety, and all these things, my first, doing an assessment, okay, you have this and you have that. The next question I ask as a behavioral health professional is, what's your medical background? Are you diabetic? Because what do we know with your blood sugar levels? When your blood sugar levels are off, that impacts your mood. I don't want to sit over here and tell somebody that they have bipolar 1, bipolar 2 disorder with mixed episodes, when really they may not know they're diabetic. or maybe they haven't taken their insulin. So I take the time as a behavioral health professional to ask those questions before I come with my diagnosis, because I want to make sure that these other areas of physical functioning, your medical, are those stabilized. And if those are stabilized, now let's talk about what's going on. So that's one of the reasons, that's the approach that I use. I had someone I was working with who had polycystic ovarian syndrome. Polycystic ovarian syndrome impact, there's a lot of different um symptoms related to this. And one of them is insulin resistance. And because polycystic ovarian syndrome in women impacts our hormones, there's other levels of where a person can have, we hear about hormone imbalance. And again, I'm not a doctor, so I don't want to get too far in the weeds. But real quick, my client was presenting, kept saying, I'm depressed, I'm depressed, I'm depressed, I'm depressed. So we're going through all this. And when it came up, I always ask women about their menstrual cycle. So when she's explaining her menstrual cycle to me, that's when I realized, wait a minute, this is abnormal. And it was through that intrusive type of work, then we realized you may need to go to your primary care physician to have them run additional tests to see if you have polycystic ovarian syndrome. And that was the best thing that I did, because now this person was able to get that situated. And those depressive symptoms that she had, guess what? They decreased. And so that to me is the beauty of having this integrative behavioral health approach. My doctor was the same way. They had to stabilize my anxiety to get my blood pressure down, just so I can function, but I can get this cardiac MRI. And so there are many benefits to this. And this is definitely something where if you're not sure your doctor's office does this, sometimes you may have to be the initiator of your integrative behavioral health and make folks do it, make them talk to one another, because that's very important. Because as we know, with people with chronic illnesses, our health impacts our mental health and vice versa. So it's important that everyone's talking to everybody. And then the last slide, and then we'll open up for question and answer, is what do we do? Okay, we got all this stuff going on. We're frustrated. We're mad. All this stuff happening, but we're still here, right? We're still here. Well, developing these positive coping skills and social support networks is the most crucial thing to do. And so what does this look like? So for me, and for other people I've spoken to, learn more about your health condition. Ask questions. I got a long email I'm about to send to my cardiologist here in a little while, because I have some questions. After doing this research, I got more questions. And there's nothing wrong with that, because I need to understand, I got to live with this mess, so I need to understand it. My son went to the doctor the other day. Oh my, they didn't told us some new stuff. I'm about to send them, we see his rheumatologist this week. About to send them a long email, because I'm teaching my son, he'll be 16 Monday. This is something that you have to live with. So we need to make sure that we know how we can do this in a positive manner, not destructive. And then what else we do? Let's engage in some relaxing activities. That looks different for everybody. I like taking pictures of trees. Something about the tree. Like, this is my favorite time of year. What else? I try to find the most goofiest TV shows to watch. So I discovered Parks and Rec on Peacock. That is the goofiest show I've ever seen in my life. It is just stupid funny. But laughter is good. So I try to make sure I get a good dosage of that. Exercise. And this was the part that was hard for me, because I had to go through cardiac rehab therapy. And so that was something which was great. But exercising, do what you can do. If it's just doing some little arm circles, if it's stretching, just raising your legs up, doing something can help. Ask for help. That was the biggest thing that I had to do. I had to call my supervisor and said, I can teach, but I can't come in. And this is what I need help with. My friends, I'll call them, hey, I don't feel well. Can you go to the store? Different things like that. And that's hard, and I know we all getting to know each other, but that's hard for someone like me. Okay. Then again, your family and friends, your family and friends is wonderful. Get an emotional support or service animal. One of my clients, she has 5 dogs, which is great. But and they really serve as her emotional support animals. And then another thing before we get to our question and answer is social support network. Check and see if your hospital, things like NAMI, um, NAMI's, that's how I just, another part of why I'm with NAMI is, again, this ties into mental health when we're dealing with chronic conditions. Check with your local hospital to see if there's support groups for heart patients, support groups for people with lupus. Maybe I know I'm in Louisville, there's some stuff with Norton's, there's groups for women, there's even support groups for kids. Some of this stuff is virtual because some of us, who may be immunocompromised, we still have to navigate this virtual world in some capacities. And then also identify other community groups for different social engagement needs. Like I mentioned, I like art. So maybe there's some type of collective that you can get involved with. But the key thing is that our chronic illness isn't going anywhere. So we have to live with it, but we can at least live with it with dignity and some type of happiness. So we can maintain. So that is it for my presentation. I'm sorry. I hadn't timed it yet. I just finished it this morning, so I didn't know how long it will go. But yes, we can definitely go to questions and answers.
Do we have questions for Robin or comments? I know we asked, could we have the PowerPoint, like the people who are participating? Okay, so she'll email that to me and we can share. I know Peter said that this was really good, that he wished a lot of doctors practice this way. Yeah, I know for me, I was very young when I was diagnosed with heart disease or CAD, and it was genetic, it ran in the family. So, I think we all experience that when you're young, and you get some sort of diagnosis that changes a lot of your lifestyle and could potentially change a lot of things that you thought you were going to be doing. So I was just able to keep my head, head on strong and do what I was supposed to do. But yeah, I think it's definitely challenging, either whether you're young or old, but especially if you're young.
I can tell you from dealing with my mother had a bundle of chronic illness problems. It was very complicated, but she got no support whatsoever from most of the doctors that she dealt with. And it was very concerning. I remember when I got her up to live with me here in Lexington, we went to a cardiologist. I said to her before she went, I said, you need to make a little list of questions you've got so you can ask him. And she went in and sat down and took it out. And he says, I don't have enough time to answer any questions. That's typical. And I think what you're showing here is just something everybody needs to know. And if you're not getting it from your doctor, you need to find somebody else who can help you, because doctors are not very responsive sometimes.
You're right. You're
and it
absolutely
puts you in
right.
a terrible position. Yeah.
You're right. Absolutely. I'm so sorry to hear that. Miss Yolanda, did you have something?
Well, first of all, I want to thank you for that awesome presentation,
Oh,
because I was in my 40s when I developed this chronic condition with my back. And so, it's been over 20 years now, and it is a challenge. And I didn't really know about those 5 stages of grief at that time. And, I struggled for years. And then somebody told me about NAMI. And that's when I started in 2006 with the Family of Family class. And so over the years, learning about how chronic conditions are affected by our mental health, I appreciate the way you broke it down. That was beautiful. It was very enlightening, and I just appreciate it. That was awesome. And you rock,
Thank you.
sister.
Thank you.
Glad I could join you all this afternoon.
Thank you. And I'm glad for this feedback because that's exactly how I'm moving my mental health practice moving forward is I'm focusing on this. Like I said, I share about my coworker. My coworker is my office mate. She's actively dealing with this now. And the last time I seen her, I think about a month ago, I mean, I'm literally in her office hugging her because I mean, it's life changing. And then she's a mental health therapist. She's a mental health counselor too, and she's researching all this stuff. And I said, stop researching stuff. And I said because I did the same thing, and if I diagnosed myself, I think I had malaria, Ebola, um, advanced heart failure. I had all type of problems. My doctor was like, "Stop it, stop it." It was just like, "Stop doing that." But depending on the type of patient, especially us as educators and a mental health therapist, we're trying to understand this. We're trying to make sense of it. And she experienced the same thing Pete just said. The community that she lives in Southern Indiana, they don't have the same accessibility. So I was like, you need to come see my cardiologist, you know. So it's just stuff like that I find that's really helpful on how we can each learn from each other how to advocate, take, even just what Pete said, taking notes and different things like that. So I'm excited on how we can grow this and get this word out because so many of us are impacted and y'all know our health in Kentucky's trash. I mean, we're just not I'm not saying we're trashy, but I'm just saying our health outcomes are just not very good. And I mean, and I'm part of a statistic as well, so we definitely have to get that out there. So thank you all for the feedback.
Yes, thank you so much, Robin. We appreciate it. And she'll send me that PowerPoint, and everybody that was in the session will forward that on to them. And I will just say in closing, I've seen a lot of announcements for pediatrician offices that are looking for mental health therapists. So we are getting that physical and mental health, like that message across that it's together. They need to be integrated together. And I hope that primary care physicians start to have 2 or 3 therapists right there at the office. And this all needs to be one, and it's not a separate thing. And it's mental health and physical health need to be integrated and talked about all together. Yeah.
Yes. Well, thank you all so much.
Okay. Well, thank you. And we'll be moving on to our next sessions, which are 5A and 5B.
Okay, you all take care.
All right. Thank you.
You're welcome.
Okay. Bye-bye.
Bye-bye.